So, um, good morning. Today, I'll be discussing methicillin-resistant Staphylococcus aureus, methicillin-susceptible Staph aureus, and then the borderline oxacillin-resistant Staph aureus. So let's jump right into it. The primary rationale for performing an antibiotic susceptibility test is to, determine the most appropriate antimicrobial agents for the treatment or clinical management of a patient's infection. And this has been, the traditional metrics in a clinical setting for the management of infectious diseases generally. So when Staph aureus is isolated from a clinical specimen, the strain can be broadly categorized into two. You talk about the methicillin-resistant Staphylococcus aureus and then the methicillin-susceptible Staphylococcus aureus, Mrsa and then mecC, respectively. So in a routine phenotypic susceptibility testing, certain antibiotics are used. We talk about the cefoxitin, your oxacillin, and then the vancomycin. They are all β-lactam antibiotics essentially. So if the isolate is susceptible to cefoxitin, now, right? It is categorized as methicillin susceptible Staphylococcus aureus. However, if the isolate exhibits resistance to cefoxitin, it is categorized as methicillin resistant Staphylococcus aureus. So we often use, cefoxitin because of its greater induction of the mecA, mediated resistance mechanism. However, both cefoxitin and then oxacillin can be used. Now, to confirm resistance at the molecular level, methicillin-resistant Staphylococcus isolate can be further categorized by detecting the mecC genes. These mecC genes can be mecA or mecC, which encode the altered penicillin-binding proteins that confers resistance to virtually all β-lactam antibiotics, right? So detection can be, of course, performed using the PCR machine, which has been, the general machine we use for detecting these genes, this resistant gene, or we can use the GeneXpert. GeneXpert is actually a rapid, molecular platform that, gives us results at, record time. So if mecA or mecC is detected, methicillin-resistant Staphylococcus is confirmed. So it's actually a confirmatory test. So detection of mecA or mecC is a confirmatory test for methicillin-resistant Staphylococcus aureus, right? However, in cases where the isolate shows phenotypic resistance, that is, appears methicillin-resistant Staphylococcus aureus by your, antibiotic-resistant test. Yes, assuming you carried out the sensitivity test and you realize that it is resistant, or Staph aureus is resistant to cefoxitin, which confirms phenotypically that it is methicillin-resistant Staphylococcus aureus. But when you proceed to do the molecular testing, you realize that there is no, mecC genes in the strain. So such a case is classified as what we call borderline oxacillin resistant Staphylococcus aureus. That's what we call Borsa. It's just like you going for a pregnancy test, and then on the test strip, you are positive presence of HCG, and then when you went or you go into ultrasonographic test, you realize that nothing is seen. So you see you are positive at one end, and then the other end, you are negative. So in antimicrobial resistance, we call this scenario Borsa, borderline oxacillin resistant Staphylococcus aureus. Now, what do you think can be central to Borsa? Borsa is essentially caused by hyperproductions of beta-lactam enzymes. That's the reason. So we have talked about what now? We talked about methicillin-resistant Staphylococcus aureus. We talked about methicillin-susceptible Staphylococcus aureus, and then we talked about Borsa. Thank you.